In this section, we're going to touch upon a number of conditions and pathologies associated with the skeletal system. There are a couple that you need to know which are associated with shortened bones. And we will discuss a few of these with the endocrine system also. If you have pituitary dwarfism, you have produced inadequate growth hormone. So you are proportional in stature, just tiny. You end up with reduced activity in the epiphyseal cartilage, so your bones will be smaller, your long bones will be shorter. It is very rare in developed countries because of the fact it is fairly easy to obtain synthetic growth hormone. Achondroplastic dwarfism is different because you have the epiphyseal cartilage of long bones growing, but it grows slowly, and it is replaced by bones relatively early in the person's life. This is a congenital condition. It is not genetic. You end up with short limbs, a normal-sized torso, and a slightly larger head. There are no effects on development other than on your skeletal system. Everything else is normal. In terms of lengthened bones or really tall structures, one of the conditions associated with that is Marfan syndrome. It is inherited. It is a metabolic condition, and you have excessive formation of cartilage at the epiphyseal plates. You end up being very tall and having very long, spindly extremities. The other connective tissues throughout the body are also affected. It is not just the skeletal system that is impacted. And these people commonly have, patients with this commonly have cardiovascular issues because their heart cannot pump enough, fast enough, or hard enough to supply the entire body. Gigantism or giantism is an over-secretion of growth hormone before puberty, so the growth plates are still open and you are pumping out a boatload of growth hormone. And some people who have this have reached nearly 9 feet in height. Puberty is often delayed. People who have this oftentimes have organ failure. They have cardiovascular issues, they have digestive issues, they have respiratory issues because of the fact that their bodies are so large and their organ systems cannot support the size of the body. This is usually associated with, or most commonly associated with, a pituitary tumor, which can be treated, or you can take medications to suppress growth hormone release. It is less common in developed countries because it is usually identified much more quickly than in emerging nations. Acromegaly is the excessive secretion of growth hormone in a skeletally mature adult. So after the growth plates have sealed, bones tend to get thicker. So you'll have appositional growth in long bones, for example, not longer because the growth plates are sealed. The bones that are often profoundly affected are those in the face, as well as the jaw and patient's hands. And there are alterations in soft tissue structures which literally will change physical features of a person. We need to talk about rickets and osteomalacia and osteoporosis. So when you talk about rickets, it is due to a deficiency of vitamin D. And it also might occur due to metabolic disorders which impact the concentrations of calcium and or phosphorus. If you're taking a look at somebody's blood, You will see hypocalcemia and hypophosphatemia, so lack of calcium, lack of phosphate or phosphorus. This triggers a failure of the bones to mineralize correctly, and you will also have cartilaginous issues. It manifests as a skeletal growth disorder. You will remember that vitamin D can be obtained from or synthesized by the bodies with sufficient exposure to the sun. So let's take a look at this. This is vitamin D deficiency. You can see the bowing of the legs. This rickets was actually fairly prevalent in the Industrial Revolution in the UK, because, especially in major cities, because there was so much pollution, kids could not get sufficient amounts of vitamin D. Rickets is the childhood form of osteomalacia. Osteomalacia is what you have when you're an adult. Your bones are poorly mineralized. You either have an inability to absorb calcium, or you have a deficiency of vitamin D, or a combination of the two. Osteoblasts can certainly produce osteoid, but the amount of minerals are not deposited in sufficient amounts. So you end up with very soft and weakened bones. And there is a list of symptoms. With osteomalacia, it means soft bones. Bones fracture pretty easily. The next step up from that is osteoporosis, which is an enormous problem, less so these days, but it can be a pretty bad problem, especially in older women, because the amount of calcium you can absorb and lay down in matrix is going to be impacted by your sex hormones. Osteoporosis means porous or holey bones. Early symptoms include the ones that are listed there: brittle nails, receding gums, less fit, you have a weakened grip. And later stage, you literally lose height. You might have muscle cramping, you might have muscle aches, you might have bone pain, you might have a stoop posture, and your bones fracture easily. Oftentimes, when you hear someone say, "I fell and I broke my hip," it is actually that the hip broke, and they fell because the hip broke because of osteoporosis. The bone is not strong enough to support their weight. Risk factors: your gender, your age, your ethnicity, your family history, whether or not you have a large body frame, whether or not you were physically active as a youth. You can lay down bone matrix up till about age 30, 35. So if you're younger than that, get out there and start weight-bearing exercise, because you can build up bone matrix and therefore bone mass. After that, it's all downhill. You can add to it, but you can never go higher than your original set point. That is set by the time you're about 30. What causes it? Long-term loss of calcium intake, potentially lifelong inability to consume calcium. We talked already about the postmenopausal changes due to that trigger sex hormone level changes. If you have GI surgery, you might not be able to absorb calcium correctly. Long-term use of some medications, including steroids, can trigger this. If you have celiac disease or IBS or some sort of stomach cancer or GI cancer, if you have liver or kidney disease, you can end up with osteoporosis. And if you live a sedentary lifestyle and smoke too much or drink too much, you can also be more prone to getting osteoporosis. So I put these pictures in here because they are quite telling. If you look at the upper left picture, the one on the left, the photograph, the one on the left is a normal vertebrae, and the one on the right is one that has had a compression fracture because of osteoporosis. What happens in osteoporosis is that you end up with a compression fracture, usually in the thoracic area. And if you have one compression fracture, that puts more stress on the vertebrae around it, superior and inferior, so you're going to end up with more than one. If you take a look at the x-rays on the right, you can see, take a look at T8, T9, T10, and the spinal x-ray. There's a lateral shot. The spinal x-ray on the left You can see T5, T6, T7, T8, all the way down to T11 marked nicely. All of those are normal vertebrae. If you take a look at the picture or the x-ray on the right, take a look at T6. Yep. And take a look at below T6 is T7. You can see basically T7 is gone. It's compression fracture. It looks like less than a pie shape. And if you look at T10, the person in this whose x-ray this is already starting to have problems with T10. It is starting to disintegrate, and it is not as robust or tall as T11 or T9 or even T8. So you can see that one major compression fracture and then another one is starting to form. And you end up with what is known as Dowager's hump. And you can actually end up, as I mentioned before, falling because your hip shatters. So weight-bearing exercise, consume calcium, don't drink too much, don't smoke. I'll get off my soapbox.